Excellent. Thanks, everybody, for being here. So I'm Jason Jones with Rackspace, and today we got a great couple of guests with us that we're going to talk about the interoperability challenge here. Zafar, if you could introduce yourself, tell us a little bit about your organization, that'd be awesome.
Good morning, everyone. I'm Zafar Chaudry. I'm the Senior Vice President, Chief Digital and Information Officer at Seattle Children's. Seattle Children's is a pediatric health system, academic, based in Seattle. We are 47 sites across Washington, Alaska, Montana, and Idaho, as well as a primary and tertiary care facility. We're also a research institute, number 5 in the country for research, number 1 in the world for infectious disease research. So our mission is providing hope, care, and cures so kids can live their most fulfilling lives.
Excellent. That's awesome. Abhi, if you could introduce yourself and tell us real quick about your organization.
Thanks, Jason. Good morning, everyone. This is Abhi Gupta, co-founder and CEO of Fold Health. Fold is a grounds-up technology stack purpose-built for enabling care teams to move to value-based care and efficiently scaling person-centered care. Before Fold, I've been in the healthcare domain for the last 12 years. Ran a digital healthcare company called Praxify that was acquired by Athena Health in 2017. Ran the business line there to scale that solution to be the largest mobile EHR deployment in US with 60,000 plus physicians using Athena One Mobile. And post that, Fold came into picture in November 21. And in the last 2 years plus, we've built an entire operating system that can enable care teams to move from fee-for-service to value-based care successfully.
Excellent. Thanks, Abhi. So Zafar, when we think about the challenges with interoperability and in the context of the way you guys deliver care and having come from that space as a medical doctor and now moving into, chief digital officer, where do you see these challenges for interoperability?
So certainly over the years, people have blamed technology issues as being a core factor in this. But I think over time, and I've been in this industry now for 37 years, over time, if you want to connect system A to system B, you can actually do that, right? There are lots of standards in place to allow you to do that. The biggest challenge I tend to see in integrations is it's a people and process problem, right? Because if I'm hospital A and I want to connect something to hospital B, yes, there's a technology component which has standards behind it, but I will have to negotiate a data sharing agreement. There will be legal wrangles that happen. Then I'll have to get clinicians to think about doing things in different ways, how they view that data from one organization to another. And that takes longer because change is hard, right? Everybody fears change, and change can cost you as much as implementing the technology itself. So, yeah, I have multiple systems, 1,699 systems running at Seattle Children's. If you want data from myself, I can send you data. But if it's going to be a legal issue, the lawyers are going to tie that up for months on end. Some won't want to share data with me because I might be a competitor of theirs, and that becomes a problem, right? We're a pediatric health system. Of course we want to dominate the world. So why would I send my data to someone else when I can bring the patient to me? So I think I see a lot of those challenges that delay projects. Once you get over those hurdles, you can turn it on and off again. Yeah. Once you get over those hurdles, you absolutely can connect systems together. And if you've got great partnerships with the software vendor, then you'll be able to encourage them to help you do that.
Yeah. So Abhi, as a startup, right, and founder and CEO, and have experienced some of this before, how is Fold Health looking at some of that people process and that?
Yeah, I completely agree with Dr. Zafar. I think many of the vendors out here, many of the technology vendors out here just come across as that technology can solve everything. This is the problem, we can throw a solution out there and solves. I think it's a 3-leg stool, as Dr. Zafar said. people, process, and the tools along with it. Without any of them, it won't work. So having been into this domain, one of the key things that was humbling, and I really value that, is shadowing actual users, right? I've got a ability that we could shadow more than 2,000 plus providers in the last 10 years, whether it is in the hallway, whether it is at the front desk, whether it is next to the kin or at the bedside. One of the things that I've seen very clearly is that the moment you put in a set of technology tools, you put a screen, you put a keyboard, you've got a bunch of papers lying in front, you've got someone who's talking from behind, the patient sitting there, something on the paper, and like 3 screens. And as a provider, I don't understand what to look where, and the way I've been taught, the intuition power just goes on out. So I think including people in process, the tools also have to understand really what goes behind, at the point of care with the providers and the care teams. And that's what we've done very, very effectively at Fold. You don't want to change the workflow of a provider. Like, just before the talk, I was talking to Dr. Zafar, and he said a web solution comes in and says, okay, I'm ready to go live. But how? You are into your EMR all the time. You need to surface that information in your EMR. You need to help your care team coordinate from there. And that has to be seamless without breaking the workflow. That's what we focused extremely strongly with Fold.
Excellent. So Zafar, as you're looking at those technologies and implementing, how do you see the clinical staff, the providers, like what is their role in all of this, right? Because ultimately they're using it, right?
Yeah, so fun fact, if you work in healthcare, who is your customer? Well, it's the patient. Are you in the business of technology? No. You're in the patient of business. Business is the patient business, right? So where we have seen success in any kind of technology project is when you could look at a technology, but you initially go to the stakeholders that will use that technology, the clinicians, show them and ask them to help you. Amazingly enough, people become clinicians because they want to help people. Who knew that was a thing? So when you go to a bunch of doctors and nurses and you say, look, I'm trying to put in this technology and I need you to think about how you can help me, as long as you give them protected time. That's the key thing here, right? Because remember, if you're a physician and you have a full workload, you can't help a technologist if you have a full workload and then you have to layer that on top. So what we found has been successful is asking for people to help, giving them some protected time to think about the problem. Because I always say to people, well, what is the exam question? What problem are we actually trying to solve? And as I'm going around this conference and people stop you, ask you questions, try to show you their technology, I always ask them, well, what problem is your technology trying to solve? And then they start to stutter, right? Because we're trying to fit a square peg in a round hole. And that's definitely a challenge. So ask for the assistance, get them involved up front. They will give you, as you said, they will give you the best advice as to say how it may fit in their workflow. And then building the technology is not rocket science anymore. If you're a cloud-first strategy organization, if you have the correct partnerships, you can build an infrastructure very quickly. You can install an application very quickly. The other thing I've learned in my career is when working with clinicians, you do have to put the extra effort in trying to get them not to over-customize something to death, right? That is the death sign. If you buy a piece of software, if I go to these guys, buy a piece of software, and then say, you need to customize this 17 times over, they won't be able to support it, and the doctors will struggle to use it. So there's a lot of communication that has to happen. And if you've worked in the healthcare environment, the number one thing people feedback on technology projects is, well, they did it to me. They didn't do it with me, right? And so those are some of the things we've certainly learned in our journey. So it's great. I am a clinician. I have a good relationship with our clinicians. But every time I have a technology problem I'll go to a group of people and say, I don't know what I'm doing and I need your help. That's immediately when people jump up and say, I'm a caring person, I want to help, what do you need? And if you do that, any technology is implementable. Same thing for interoperability. Once you have a set of standards, you still have to ask the people who are using that data how they want to see the data, how they want to consume that data. It's not just about me saying, well, I gave you a web page, go there and look up the data. No, people want to see it in a particular format, depending on specialty, depending on how they practice their medicine.
Yeah. So Abhi, when we hear what Zafar's talking about on that integration of the clinical staff and the providers, in this shift, to value-based care, and we've heard that, the buzzword for a long time, but we're actually getting to that point, right? How are you guys, making that move and really truly presenting that back so it's usable from a clinical point of view?
One of the key things that I truly believe in is technology is just an enabler. So two things that Dr. Zafar said. One is getting the care team and the physicians involved as early as possible, even in your product build, right? Not even going further and selling it out as early as possible in the early story. In Fold, specifically what we did is when we started the company, we took a bunch of 10 practices that laid out between 15,000 patient lives and then started co-building the entire technology along with them. So it was almost like on a daily basis that we could work with their teams and we could work with the care team members to really fit in and understand the workflow. Now, as he said, it's also death by nail by over-customizing it for a specific thing. That's the reason why you choose not a provider or two providers, but you choose a bunch of them and then understand and abstract it in a way that you can create a technology stack that can scale. That's the key piece that I think is important. The other thing is that to have clinicians on your team, it's extremely important. We've got Dr. Maha, who used to lead and chair the emergency department at Stanford. He's a professor there for the last 25 years, coming in as a chief medical officer. We've got primary care physicians, we've got nurse practitioners in our team who are basically from day one working with the engineers to get the technology in place. So it's a very different fundamental approach, and I agree with Doctor completely, saying that you can't just go and push a solution out to a physician saying, now use it.
Right.
Yeah, and if I could just add, the other thing that's really interesting that I'm seeing in my organization is the generational gap with the technology. So when we have a doc or a nurse who's Gen Z, they look at the technology in a very different way than the Gen X and the Gen Y. And so your messaging has to be tailored slightly differently. And it's quite interesting because being at a technology conference, a lot of people have told me that, well, it's just, you could just use it. It's really simple to use. Well, I'm old. It's not simple to use for me. I'm still trying to figure out how to use my iPhone. Whereas if I bring in a nurse who just graduated nursing school, she'll run rings around me in terms of how to use that device or how to use the technology. So you also have to make an adjustment for that. And, message to vendors, hope is not a strategy in healthcare. So you really do need to do the right steps. So I think that's a great approach if you are bringing in clinical people to help guide you, build UIs and build workflows, then your engineers who don't understand that will start to understand that. And that's really important.
Yeah, so, and we'll just solve this whole problem with AI, right, Zafar? Like, it's just going to overnight.
Yeah, apparently, if I don't say AI at least 5 times today, then I am not credible. So that's the first time I've said it.
So what about legislative, right? I mean, we know there's technology gaps, right? And we know that people can solve the technology gaps when we integrate. What about from a legislative perspective? I go there lightly, right? But I think there's something to talk about.
So I think there's a huge amount of value at the federal level to come up with standards. And I think there has been an attempt to do that. The challenge in the US will be, how do you enforce a set of standards? It's different in socially funded health systems. I'm ex-NHS, and it was different in the NHS because the government could actually mandate that if you want to do business, you must comply with these standards. Whereas here it's more so, it's a guidance, But the guidance is out there. And to be truthful, when you talk to good established vendors now, and you talk about interoperability, and you say, do you comply with this standard? Are you fire enabled and all of those things? I'm seeing more and more of that actually happen. But once again, I go back to, I can take a piece of data from system A to system B. How I expose that data to the person that's using it is where the challenge still becomes, right? Because I'm not being funny. As a physician, I'll say that if my button isn't blue in the top left-hand corner of my screen, I just cannot do my job, right? And we tend to forget that piece.
Yeah. So Abhi, talk to us a little bit about, from your perspective as doing that development very closely with the clinical staff, how important to you is the legislative point of view?
Yeah, I think legislation plays a big role, especially helping in standardize, a lot of things. I remember it's 2013, 2014 when we integrated into Cerner with our last startup. And we were looking at integrating into Epic, Meditech, others. There weren't FHIR APIs. There weren't one single interface to work across these EHRs. We had to do a lot of hard work in understanding M pages, CCLs, and so many stuff that we had to get to do a basic integration. So legislation has really helped overall from standardizing. How do we think about creating the stack? How do we think about the common data model? How do we think about point-to-point interoperability? So yes, I think those things have really helped in laying a grounds-up approach for Fold Health as well, especially with the Cures Act and the last few years of forward-looking legislation. It has given us a clear guidance that irrespective of the type of organization, we are heading in that direction completely. So now today, for example, we could finish an integration with an EHR in a quarter. It was never possible before. And that's the key piece with legislation.
Yeah, I think, so as you were talking and I was thinking about that, and I'm just kind of looking out over the sea of booths here, how do you guys do that level of integration, right? I mean, all of these organizations, they have their own data models. Sure, they have a common interface or that. Like, how are you looking at this ecosystem of providers that are talking to the organizations like Dr. Zafar? And what does that look like from your guys' point of view?
I think it's hard. You have to do one system at a time, one EHR, one point solution at a time, and which is where also Fold Health comes across really strongly. As Doctor was saying, any health system has 100+ solutions today. And we are seeing what's happening in the news today with change going down for last few days now. So the security piece also is a big challenge when you've got so many point solutions and data points across. These data silos were never created from a perspective of working across the workflow. They were created only for a specific set of use case. And suddenly, just because there was no solution that could pan these entire segment, people were taking, okay, I need a CRM, I'm just going to plug it into my EHR. I need a communication engine, I'll do that. I need some kind of a telehealth story, I'll plug it in. Nobody's thinking about how a patient identity will flow through all sorts of engine. There is no clear common data model across them. There are interfaces of FHIR and everything else, but beyond that, as he said, it's very difficult to even understand where to surface what data at what point of time. Right, and that's where Fold has taken a very different approach than many of the vendors out here, saying we are going to augment your EHR, we are going to let the physician work in their existing workflow and enable the rest of the care team to have a home that can enable them scale patient-centered care effectively.
Yeah, that's super interesting. So you kind of opened up, I don't want to completely open up the wound, but you opened up a security wound. Dr. Zafar, like when we think about all the business and the legal and all of that, ultimately at the end of the day, security is paramount. How is Seattle Children's looking at this interop challenge and all of that from a security lens?
And I think security has bubbled to the surface more so in the last week than in many, many years, but it's always an afterthought in the health system. security. So if you were to ask any physician, how many times do you want to log into a system, they're not going to want to log into a system. If you ask them, can we have a password or no password, they'd rather go with no password. If you look at their device sitting on their office desk, you'll see lots of sticky notes with all their passwords on them, right? But with this interoperability issue, there's another problem that's coming to the surface. So yes, there's standards. I have an interoperability team. They use a tool to connect system A to system B, sometimes in partnership with a vendor. But our biggest risk that I see bubbling to the top now is how do you secure that interoperable environment that you have built? If you built it on-prem, you probably don't have the right security protocols on it. And guess what? It's transacting millions of items of PHI data. If you put it into the cloud, you do have the value of a cloud provider's security, but have you hardened that security yourself around it? And the answer is probably not, right? Because we don't necessarily change passwords as frequently as we should, or have the complexity of passwords that we should. So I think the next big problem we're about to see in the security space around this interoperability is going to be hospital systems who have piecemealed connections together in interfacing, who aren't securing them correctly. Because a lot of times that's done in-house. And guess what? We're the champions of not writing anything down. So if I was to say, can I give you a list of everything we've connected? Yeah, at a very high level, yes, but probably not at a granular level. I think there's an opportunity now for health systems to look at, is this really something we want to do, or should we start partnering with specialists in that space to help us? But unfortunately, budgets as they are in health systems, we tend to slack off on budgets in security and budgets in training.
Until it's too late.
Until it's too late, yeah.
Do you see a path for us to overcome some of that until it's too late, right? I mean, obviously, when things hit the news, it gets a couple months of board airtime, and beyond that, it goes back away, right? Some of that is operating margins that you guys are struggling with and all of that, but is there a path forward where we can bring that level of, hey, we're now doing business across a multitude of organizations. The board needs to invest in this for our own organization.
So the saying is, never let a good crisis go to waste. And the only way you're going to get clinical people on board, boards on board, executive leadership teams on board is through education. So certainly what's happened in the last week, and prior to that, we were dealing with some security incidents in our region. We've taken the advantage of now providing daily progress reports to all of the clinical leads. But we've pared the messaging down. I like to say, if you want to talk to clinical staff, talk to them at 8th grade level and don't use big technical words. They're very smart people, but their job is to take care of patients, not to understand the difference between Lockbit and this and Bitcoin and all of those things. So we're actually using this to our advantage by having daily briefs on what does it mean when you hear about Change Healthcare, hear about other things happening in our region, and how does that impact you? So we've done a call to action pretty much every day now. It's coming out that says, make sure you don't share your password. Make sure you're not clicking on that amazing link that's going to transfer 10 million to your bank account from Nigeria. Don't do those things. I would love to do them too, but the money won't flow. So we've done a lot of work in that space, and we're seeing a good reception to that. So as a consequence of that, a lot of the clinical divisional leads have asked my team to come and talk to the group.
Right.
What's happening? Because they're worried, right? Fundamentally, what's happened is a national impact.
Absolutely.
So if you can educate and give some coaching, people do try to listen to that.
Yeah, I mean, every child needs their chemotherapy, right? Like
Exactly.
absolutely. So Abhi, as you hear, and Dr. Zafar talking about security as a developer, and most likely a number of developers in the audience and around, how do we help overcome some of that, right?
I think some of the things that Dr. Zafar said, many vendors put this across as an afterthought. And that's where I think the biggest issue is. You're just doing a tick mark job of HIPAA compliance or a SOC 2 compliance. And now there are companies who can help you do that. So you don't even have to get into that. But I think some of the things that we need to look into, the way what we've done at Fold is zero trust architecture, right? You have to have that inbuilt from the ground layer, that you'll have a zero trust architecture. You need to go and educate physicians why it is important for an MFA, right? Why can't you just put a password up there and still you are able to log in? Why do you need a token to get in? I think those kind of things really help a lot in getting into the whole system. But very strong, I think security cannot be built as an overlay on top of a technology solution. It has to be built within and grafted in from ground layer up together. That's the key piece, and I personally feel is important for any technology vendor.
Yeah, absolutely. So we just have a couple minutes left. I want to reserve some time for questions. If anybody in the audience has anything they'd like to ask at all. Excellent. So Zafar, just some quick final thoughts of, what is your overall message to, I would say startups or long-term, organizations really trying to, hey, we've solved the problem for you. Come and look at this. Like, what would be your final thought to an organization?
So anyone building a company from the ground up in healthcare technology, yes, build the right technology, build it on standards, think about security, but most importantly, think about who you are going to bring into your advisory board or onto your team that is clinically centered. And when you are technologies to health systems, it is not the easy red button. So you have to acknowledge that, and you have to come with an approach that brings in process and change management. Otherwise, you're not going to be successful. People don't like the next shiny toy because they have plenty of toys in their portfolio already.
So Abhi, same question to you, right? Final thoughts as you're looking to change the world of value-based care and on a great path doing that. Congratulations. What does that look like for you guys?
Yeah, I concur with Dr. Zafar. I think anybody who's going out and saying, I've got a tool and it doesn't need any training, it's like a zero training story, it's not real. They don't understand the point of care. They don't understand what's going on at the care teams, at the provider groups. So it's very critical to make sure that there is a good amount of investment in change management, in training, along with the tool sets that you're bringing in. And with the clinicians on board early on, I think it is very, very important for them to understand why they're doing what they're doing. Not because, hey, there is a regulation to do a CCM and you just need to click these boxes and finish a care plan. What is it going to help? How is it going to impact the outcome for the patient? Because they're there for the patients. And I think that's the critical piece that we look forward whenever we are heading into any practice group or health systems. I think that's the key message that I'll take. And great thoughts, Doctor, to keep us moving forward.
Excellent. So just a real quick plug for myself. So from Rackspace, obviously, we're doing great work with these organizations, right? And we can't do it without, we're the primary infrastructure provider, right? From a managed cloud perspective. And these guys are doing the great work, right? And we just want to put them forward. And Dr. Zafar, thank you for your time. Abhi,
thank you, everyone.
Thank you for your time. And yeah, the challenge isn't just technology, right? People, process, legislative, sometimes the legal department, it can be some of the bigger challenges, right? But they're mandatory hurdles to overcome. I think we just think interoperability, oh, technology, check the box. And like we've heard today, it's not. It's far from that. So thank you, and I appreciate your time.
Thanks, Jason. Thanks, Doctor.
Thank you.